So Taylor and I are going to be doing Chromium. So what is it? It is an element that exists in small amounts in the body and is used for food digestion. So people do get enough of it in their regular diet because it does exist in so many foods. Just to list a few, there's brewer's yeast, meat, potatoes, cheese, hard tap water. So it is very common in a lot of foods. But who would use it? So there's people that might be at risk for deficiency, such as the elderly, menopausal women, diabetics. There's use for it with cholesterol. There's also some evidence, but it's not very sufficient for atypical depression, bipolar disorder, age-related mental decline, obesity, and weight loss. So the effects of chromium are that it turns fat, carbs, and protein into energy. So it moves that glucose from the bloodstream into the cells to be used as energy. And then low chromium levels are linked to increased risk of glaucoma. And like I mentioned before, chromium helps menopausal women by slowing bone loss. So with the glucose thing, there does need to be more studies done to understand its role in controlling blood sugar for type 2 diabetes. So some of the side effects is you can excessively supplement it. So if you're getting too much in your diet and then you're supplementing chromium into your diet, you could have some stomach problems, hypoglycemia, because this is helping you lower blood sugar by utilizing it, liver damage, kidney damage, you can have an irregular heart rhythm. So also if you're taking antacids, it can interfere with the absorption of the chromium. You can have an occupational overexposure, which can lead to kidney damage, lung cancer, eczema, and other skin conditions as well.
So now we're going to look at some drugs that have the same effects as chromium, not for the whole drug, but parts of it. So the first one we saw was insulin. So just like with insulin and chromium, with improper use, it can have you become hypoglycemic and that low blood sugar, which would be not good if you're a diabetic. Also, vitamin B9 or folic acid, as we've learned about before. This vitamin helps convert carbohydrates into glucose, and this is exactly what chromium is thought to do, to create energy for us. Cinnamon. We looked at some studies, and cinnamon has been found to reduce blood sugar as well as cholesterol, and chromium does the same thing. And then finally, omega-3 fatty acids, aka those fish oil tablets that we take, those have been shown to decrease the bad cholesterol or LDLs and increase the good cholesterol or HDLs. So now we looked at some drugs that we need to watch out for if we are taking chromium. Again, insulin, those two combined together can again create that hypoglycemic effect. Levothyroxine, it's a drug used for hypothyroidism or an enlarged thyroid or thyroid cancer. If you're taking this drug with chromium, chromium is likely decreasing its effect, which is not good for people that need it. And then finally, aspirin, which can increase the absorption of chromium. So some precautions that we found when taking chromium. If you're pregnant or looking to become pregnant or breastfeeding, it's most likely better that you take a lower than adequate daily intake levels for chromium, just so you don't get too much of that into your baby. For kidney and liver disease, we found 3 reports of kidney and liver damage, respectively, and so that is one thing to keep an eye out for. Maybe consult with your doctor before you decide to supplement with chromium. And finally, I think one that's been pushed so far in our presentation is diabetes. They can lower the glucose levels more. And then so we looked at a couple studies. Some big points we found was type 2 diabetes, chromium increase the glucose control in chromium deficient populations. So if the populations weren't meeting their adequate intake goals for chromium, then they had an increase of glucose control, but if they did get enough chromium, then no difference was shown in glucose control. We also looked one with lipid metabolism for chromium, and they showed there was a possible increase in HDL levels and possible decrease in LDL levels, but more research, of course, is needed. And then finally, looking at what chromium does, it's easy to see how people could want to take this drug for weight loss and helping out with their body composition. So finally, would Casey and I recommend this to our family? We're not sure if we would necessarily recommend that they take direct chromium supplementation. I think we would rather them just eat foods that are high in chromium to get that, as well as exercise. So eating real foods will help out a lot. We looked up some common foods that are high in chromium. It was broccoli, whole wheat bread, turkey, and then a bunch of fruits and vegetables. So that's just part of having a healthy diet is important. The needed dose every day was pretty small. It was 35 micrograms or 0.035 milligrams. So that's not a lot of chromium. And then, again, exercise. This can help control your glucose if you're having trouble with it, as in diabetes, or just anyone really that's overweight or that needs help with monitoring their glucose. Exercise can do that effect, and so we would push diet and exercise before telling our family to take direct supplementation. Those are our sources, and let us know if you have any questions.